Okay, I'm going to do a quick video on how to run Veletri with this IV pump. So the first thing you want to do is you want to hit power on. It's right there, system on. It's going to start up. You also want to gather your supplies. You need an aerogen generator. You need the tubing. It's got this on one end and it's got the screw in on the other end that goes to the syringe. You're going to get a syringe from the pharmacy. It's going to be like this, but it's going to have a brown bag around it. So you're probably going to have about 40 mLs in it. So first thing you want to do is screw your syringe on the top, hold it up, of course, and screw your syringe on the top. So that's that. You want to squeeze a little bit of stuff and prime your tubing till you see some come out at the end of here. Once you do that, you're going to stick this bad boy up in here. You need to pull this little lever and spin it. It's best if you just hold this syringe and open the fins and lower it down on top. You want to hit new patient, yes. Respiratory therapy, yes. Okay, you want to confirm that. Now you want to select your channel right there. It's also going to ask you if it's a Blastopack or Monojet. It is a Blastopack. 50 to 60 ml syringe are always Blastopack. Confirm. Guardrail drugs. You always want to use guardrail drugs. So select that. Epiprogesterol, that is what you need. Yes. You want to confirm nebulization. Yes. So once you have your tubing primed, go ahead and screw your little other end in there. Connect your aerogen generator to the power source of the aerogen generator up top here. Just set it right there. So, patient weight. It's always going to be on the syringe. There's going to be a label. Try to put it out so you can see it on the outside, but still see the mLs left. So, well, for some reason it went off. It took too long. I'll go back in to where I was. Confirm. Patient weight, 45 kilograms. Let's go with that. You hit next. Now, VTBI, that just means volume to be infused. This has 40 in it. You want this thing to alarm when it gets about down here at 5. So 40 from 5 is 35. So just go ahead and put 35 in there. And you hit start. It's going to start running, but you have to turn your aerogen on. And if you turn it on, it's going to default to 30. Push it again, and it'll go to continuous. Making a light out of me. There it is, continuous. So that's what you want to see right there. You want to make sure you have fog. This is an ultrasonic neb. If you don't have fog, you can sometimes thump it. If you're working night shift, just put your flashlight on when you change your syringe and make sure you're getting fog. So now you want to, the syringe is empty, just imagine that, and you want to change it out. Pause it, flip your little lever here, pull your syringe out. It's best if you just pinch it right here and unscrew your syringe. Then you get your new syringe, put it on. If you pinch it, you won't lose your prime in this tubing. So put your syringe back in. That goes in between this little gray and the beige. Hold your shaft here, lower it down. And then you want to select channel A again. And it's Blastopack again. And confirm. Now when you hit confirm, you look down here, you see restore. Go ahead and hit restore. It's going to keep what you put in there before, the kilograms, and the syringe volume. So you hit next, volume to be infused, start. That's all there is to it. Now, if you go to CAT scan, and you can hook this on an IV pole on the back of the bed, and then if you get a 15 and 22, you can connect this to the ET tube of the patient. Just make sure this stays up and down while they're traveling. But once you get down there, If you notice, when you undo the power, it's now going to go to 30 minutes. It's best when you get the CAT scan, plug it in at CAT scan, and hit continuous again and make it stay in continuous mode. If not, it could possibly run out. You just don't want to run into that situation. Just always make sure that you have medicine in here and you're fogging. That's the most important thing you got to remember. The ventilator, there's another video on the ventilator setup. 2 bacteria filters. You got to change them Q shift because this stuff is sticky and it'll clog up your bacteria filters. Other than that, you start weaning when the patient's doing better. There's a protocol online on in MyNet apps on PolicyStat, and you can see that you got to go down by 1 every hour as long as the vitals are good. So to do that, just go back in the channel select, and there's your dose. So see it as a 0.05. Hit that and put 0.04 and hit start. Go for an hour. If the vitals are good, the saturations are good, they're hemodynamically stable, go ahead and do it again. You're going to turn your dose down to now 0.03 and hit start. And so on until it's time to turn it off. Thank you very much.